options. Question 1. A 12-year-old boy presents with recurrent viral infections and lymphopenia. A lymph node biopsy reveals underdevelopment of the paracortex. Which of the following conditions is most likely responsible? A. Bruton's agammaglobulinemia. B. DeGeorge syndrome. C. Severe combined immunodeficiency, CID. Common variable immunodeficiency, CVID. E. Wiskott-Aldrich syndrome. Correct answer, B. DeGeorge syndrome. The paracortex houses T cells, and it is underdeveloped in DiGeorge syndrome, which involves thymic aplasia and T cell deficiency. Why not the others? A. Bruton's equals B cell defect affects follicles, not paracortex. C. CID equals affects both T and B cells, but presents with absent lymphoid tissue, not isolated paracortical underdevelopment. D. CVID equals B cell issue, normal paracortex. E. Wiskott-Aldrich equals combined immunodeficiency, but doesn't specifically cause paracortical hypoplasia. Question 2. In a lymph node, B cells are primarily found in which of the following areas? A. Paracortex. B. High endothelial venules. C. Medullary sinuses. D. Follicles. E. Capsule. Correct answer, D. Follicles. B cells localize and proliferate in the follicles, especially the secondary follicles with germinal centers. Why not the others? A. Paracortex, T cells. B. HEVs, entry points for both T and B cells. C. Medullary sinuses, macrophages, and reticular cells. E. Capsule equals connective tissue layer, not lymphocyte location. Question 3. Which lymph node region enlarges in response to a strong cellular immune reaction, such as EBV infection? A. Follicle. B. Paracortex. C. Medullary cords. D. Medullary sinuses. E. High endothelial venules. Correct answer, B. Paracortex. The paracortex contains T cells and becomes enlarged viral infections like EBV due to paracortical hyperplasia. Why not the others? A. Follicle B cell response, humoral immunity. C. Medullary cords contain plasma cells not involved in early T cell expansion. D. Medullary sinuses, macrophage-rich, not lymphocyte expansion. E. HEVs, entry points, not sites of immune proliferation. Question 4. Which structure in the lymph node allows both B and T lymphocytes to enter from the bloodstream? A. Afferent lymphatic vessel. B. Medullary cord. C. High endothelial venule. Subcapsular sinus. E. Efferent lymphatic vessel. Correct answer, C. High endothelial venule. HEVs in the paracortex are specialized blood vessels that allow lymphocytes to exit circulation and enter the lymph node. Why not the others? A. Afferent equals carries lymph, not blood. B. Medullary cord equals plasma cells, not for entry. D. Subcapsular sinus drains lymph, not blood. E. Efferent equals lymph exit, not entry. Question 5. Which region of the lymph node contains closely packed plasma cells and lymphocytes? A. Cortex. B. Follicle. C. Medullary sinus. D. Medullary cord. E. Paracortex. Correct answer. The medullary cords are rich in plasma cells and lymphocytes and part of the medulla. Why not the others? A. Cortex contains follicles. Follicle B cell area, less plasma cell density. C. Medullary sinus macrophages, not plasma cells. E. Paracortex, T cells. A lymph node biopsy shows many pale germinal centers. This finding is most consistent with which of the following? Primary follicles, paracortical hypoplasia, C. Secondary follicles, D. Medullary sinuses, E. Medullary cords. Correct answer, C. Secondary follicles. Secondary follicles have germinal centers, which are pale and active, indicating B cell proliferation. Why not the others? A. Primary follicles, dense, inactive. B. Paracortical hypoplasia affects T cells. D and E. Medulla was not related to B cell proliferation centers. Would you like a printable version or one